Okay, let's get into our first topic then, and we're asking, is the government to blame for the NHS crisis? Leading doctors and NHS leaders say that the health service is in a state of national emergency. This comes as a record number of patients aren't getting their cancer treatments fast enough. Shadow Health Secretary Wes Streeting said that you would have to be living on Mars not to see that the NHS is in an emergency, and blamed it on the Tories, saying that it is the Conservatives' neglect over 14 years that has caused this mess. The Tories disagree, and the Health Secretary Victoria Atkins says that the NHS is beginning to see change. So who is right? Are the Tories to blame for the NHS and all the chaos? Lowri?
I think it's multifactorial. I think there is an argument to be made that the NHS is not funded well enough, certainly in certain areas. Although there's very good treatment for a lot of people, we shouldn't always be a down on the NHS. You know, there are also very good people working and very good treatment available. I think we've got issues to do with staff shortages. Why are there staff shortages? Is it all about pay? Is it about retention? What's going on there? What about recruitment? We've got issues to do with an ageing population, and we've got a growing population. So I think that Dr. Leaders are right to say that we need, when the next election has been, for there to be a conversation about where we're going to take the NHS, because where it is currently, it's not sustainable if we're going to have an ageing and a growing population.
Is it not sustainable, or has it been mismanaged, Susie?
Well, you've got to say that the NHS, without which we wouldn't have an economy, we wouldn't have our taxes, we wouldn't have the same number of workers, we'd be really struggling in lots of other ways without the NHS. That is the responsibility of the government of the day. So therefore it has to be the government's fault in a way if it's not working, not doing the job that it should do. Shortly, of course, it's going to be a different party of government's responsibility, and we'll be having all these arguments again in 12 months' time about what Labour is or isn't doing. But yeah, you have to say it is the government's, one of their central responsibilities is to keep its citizens safe and to keep us healthy. And partly that is going to be providing the right services, managing it properly and doing it effectively. And what we've had instead are people playing politics with the NHS, and whether it's Labour, whether it's Tory, going into the system which we all rely on to birth our children, to care for our parents when they die and so on, and making it a political snowball fight. It's just, that's not helpful, and it hasn't been, as we've seen, it's just,
that's exactly what Wes Streeting is doing. I mean, it'd be interesting to see if, we do say if, which is we have a democracy, if Labour does come in, they'll be the party of government, not the party of opposition. And then they will have all the unions from the NHS coming back to them asking for more money. And that will be interesting to see how they manage that going forward. Are they going to spend a lot more money, which a lot of people would like them to do? And if so, where's the money going to come from, and where's the money going to be taken away from? It's much more difficult in government than it is in opposition.
And they've also got to do reforms, which lots of people aren't going to be very happy about.
Well, so it's interesting you talk about reform there, actually, because what I was going to say was across the globe, no other country has set up a system like the NHS, free at the point of care, at the point of need. Is there a reason for that? Is that because actually a system like the NHS is unsustainable for ageing populations, expanding?
Well, there are systems of socialised healthcare, particularly in Scandinavian countries, and they do generally work very well when they have the right investment and the right attitude about them. We've got in this country this kind of half in, half out attitude, and we always have done since it was formed, with one part of society going, this is ridiculous, we shouldn't be doing that, and the other half of the country going, yes, we need the NHS, thank you very much. And generally, the majority of people are for it, but it still becomes something that politicians argue about. Whose responsibility is it? Who claims victory for having founded it? Who claims victory for having reformed it? And it becomes something that they argue over. And I think it should just be somehow protected. I mean, we have to have the people in charge of it to be democratically accountable because it's so important to us. But there has to be some protections, I think, for the NHS, that it doesn't get chewed up and torn out in the normal rough and tumble of politics.
OK, I just want to go to some calls. Christine from Middlesbrough, you're up first. Do you think it's the Tory government that's responsible for the chaos in the NHS at the moment?
Oh, hello, everybody. Partly, but not wholly. I mean, all the government seem to do, I mean, in my opinion, they're quite spineless at the minute. They throw millions of pounds into the National Health. Once they've thrown money at them, they think their job's finished, where they should be looking at the source of all this crumbling NHS, i.e. management. I mean, all this money is going to the management. Does anybody check what the management are spending it on? Because the way our National Health Service is going, obviously, they're just spending it on the wrong things. Okay. We shouldn't be in this position if money was handled correctly.
I mean, there is an
NHS managers and the government to blame.
So you think it's mismanagement? I understand that, but there is an argument to say that actually the NHS has been underfunded. You know, the payment's been stagnant, so they've actually been getting less money year on year rather than more with an expanding ageing population. Even if you manage it the best it possibly could be, you would still be down.
No, the management are wasting thousands of pounds. I mean, one example, all these diversity classes, you know, thousands of pounds are being spent on that, ridiculous. Thousands of pounds spent on things that have nothing to do with the patients. The patients should come first with every penny they get, and I'm afraid it's not happening. The management we need a strong government that have a backbone and will get in the National Health Service and sort it out, i.e. the top down to the bottom.
I think you know, the NHS is a huge organisation. You have to have people to manage it. You can't just have doctors and nurses.
No, otherwise there's no one done the cleaning.
But it is the complaint that we get time and time again, that there's too many middle managers.
I know, and we often get people who call in who are nurses, for example, and they complain also about management. So yeah, there is something going on about where the money is not being spent in the right places. But I think it's very easy to just say, oh, these managers don't know what they're doing. Yeah. And I also think we have to remember, I'm not a big fan of diversity education in workplaces, but we do know with the NHS that, for example, if you're a pregnant woman, that you appear to have worse outcomes if you have a brown or black skin. So there is a place for that.
Yeah, because it then affects the patients. And Christine, we're putting the patients first.
What we have seen, when they've cut managers, what happens is medical staff, Christine, are required to do that management and that paperwork. And I've been in hospitals recently with relatives, and what they are constantly doing, the medics at the end of the ward, they are constantly on the computers doing little tick boxes and forms and trying to find things to load and going through the software and doing it 15 times in different pages. And that's because the medics are being made to do what the managers should be doing.
That answers my question. The management aren't doing the job. It's as simple as that. There's something lacking in the management. I mean, it's coming down the line and those at the bottom are suffering through it. There needs to be reform. There needs someone to get in there, sort it out. We're just losing our National Health Service, and that is a tragedy to every person in this country. It needs sorting.
Both panellists nodding to that. Sarah from Liverpool, what's your thoughts? Is it the government that's to blame, the government of the day?
Morning, Storm. Morning, panel. Yes, it is the government to blame. I've been watching the destruction of the NHS for the last 13 years by this bunch. Anybody who's been watching what's going on and what they've been doing would see that they have been merrily taking the NHS apart.
What parts particularly, Sarah?
Well, for a start, the one thing they did when they first got in was they took the money from the hospitals and gave it to the GPs. Now, it's great if you've got a GP who actually thinks of the patients and says, right, I will make sure that my patients will get into hospital and blah, 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 and see consultants because they need to see these consultants because I don't know. I'm a generalist, I'm not a specialist, they need help from them, not me. That's great, but most doctors, or GPs I should say, I'm going to hold on to them. I'm going to hold on to these patients because I'm going to do it. And I've seen it firsthand with patients.
OK, I mean, it's the first somebody's brought this to light that actually the GPs aren't sending people to specialists.
Well, that's the role of the GP. That the GP is like a safety net through which you're supposed to filter patients so that if you can treat them with a GP, you do. And therefore, they don't all go to A&E. Part of the problem we've got at the moment is that there's so many holes in that safety net because there aren't enough GPs that they're all going to A&E, which is why it's got so many queues in it, because a lot of that stuff is things that should be treated in the community.
Sarah, thank you for your call. Terry from Kent, what do you think the problem with the NHS is and who's to blame for it?
Both of them, the Labour and the Conservatives, because back when the Conservatives took over from Labour, they turned around and said that because there's lack of funds in the kitty, that there'd have to be cuts.
Yes.
So, and also the Conservatives, because they had a short gap between trying to get the finances back to normal, which they did just before COVID, what they should have done was made it go over a longer period so that more money could have gone on national health. So basically, they're both to blame.
OK, so you're saying that the Tories inherited a terrible financial environment where they had to make budget cuts, and the whole problem has just been compounded from there, and then with COVID even more so. So what's the solution then, Terry?
Well, it's all right looking back and saying, oh, we should have done this. But the thing is, whoever's in charge from now on, if Labour gets in, they're going to have the same situation. There's going to be no money in the bank, and they're going to have to start cutting back exactly the same as the Conservatives. So basically, one's doing what the other one does. So Labour's left with no money, and we're in the situation where the Conservatives are trying to put it right. Now we're back in the same boat. No money, so Labour's got to do exactly the same.
If you were Keir Starmer and you get in the next general election, what's the first thing that you're going to do?
I wouldn't do that job because no matter what he does,
well, that was the easy way out there, Terry.
No matter what he does, he can't win. Whose plans about it?
But that is kind of, and a point I was trying to make earlier, I suppose, is the truth that when it comes to the NHS and the way that it is now and the structure that it is now, is it a sort of lose-lose scenario for whoever's in charge, Susie?
It is a bit, if you want to carry on with the status quo and say, well, we need to fix what we've got. What you actually need to do is to create something that's better and newer. And one of the things that would help enormously with all the problems we've got in the NHS at the moment, I think, it's my opinion, is a national care service. There would be huge benefits in terms of getting people out of hospitals quicker.
Social care?
And a social care that's actually nationalised in the way that it should be. There would be huge economies of scale across the NHS and an NCS that could actually work together and cooperate. It would be a big bureaucracy, and it's one of those things that the politicians will argue about. And like Christine, the first caller, was talking about management. We've had so long demonising the management. The reason the management is bad is because they all got fired because the politicians were telling us, you don't need managers, you only need medics. You need both. A brain surgeon can't save a life if there's no one actually managing the beds and sorting out where the laundry's happening, all the rest of it.
Interesting. Terry, thank you for your call. We're going to speak to Lindsay now from Hampshire. Lindsay, what's your thoughts on the NHS and the chaos it's in at the moment?
Well, not surprised really. I've worked in the NHS social care and the independent care section, not-for-profit, since 1987. And we have waited and been promised since then that we would have a more integrated service, integrated IT. Oh, where did that go? But integrated care. I think about 10 years ago we were promised a white paper. I don't blame any particular government. What I'd like to see, and I think lots of my colleagues would still like to see, ancient as we are, is that we have, this is bigger than party politics. This should be non-partisan. We should have cross-party committees that continue from government to government. If you go into healthcare, you will get a good service. We give a great service if you're in acute healthcare. If you're in the community, you're on your own. Or if you go into social care and nursing care, £2,000 a week. So there is no link, there's no integrated service across the great divide.
But I'm interested, Lindsay, why that hasn't happened, because you said there's been a white paper. Is it because this is going to cost a huge amount of money?
It never got to a white paper.
Why?
It didn't go through.
Why do you think that is?
Because there wasn't the political thirst for saying, let's expand or, double up.
Because it's going to cost more money.
It will cost more. It also saves you more.
Yeah.
And what you can't say when you start out with something like that is what it's going to save you. And one of those things we never talk about with the NHS is how much money it saves us and how much of our GDP it protects. We always talk about the cost. We never talk about the benefit.
It also seems that we're talking about the NHS as a separate entity to social care, but actually so many of the problems in both, they cross. Lindsay, so you might actually have a point there. It's very interesting. Thank you for calling with your experience actually in the NHS. Una from London, what's your views on the chaos that we're seeing in our health service?
Hi, good morning. I think 100% the GPs are to blame for the chaos in the NHS.
You're the second person to say GPs. Explain to me why you think that.
GPs are not pulling their weight. Anybody who goes to A&E or outpatient clinics, the doctors and nurses there are literally run off their feet. Yeah. It's so unfair to see that. But they do it with a smile on their faces and treat people so well. The GPs don't even want to see half their patients. They want to make a phone call if you're lucky enough to get a phone call.
Do they not want to see patients, or do they not have enough time? I.e., is it potentially the problem that there isn't enough GPs?
It's nothing to do with time or GPs. It's that the GPs we have are not doing their hours that they should be doing. That's what it's about.
And are you a healthcare worker? You sound like...
I work in a GP surgery.
Okay, well, you would have an inside scoop. So when you say they're not pulling their weight or they're not doing the hours they should, what are they, just packing up after lunch and heading home, or what's going on there?
Some of them. I mean, we have young GPs who work one morning or one afternoon. When I first started in the GP surgery, the doctors we had were doing morning and afternoon sessions.
So, Una,
now,
I have to ask, how are they paying their? I mean,
Are they
obviously
working
they have to
privately
work.
the rest of the time? What are they doing the rest of their time?
Yeah.
I have no idea. That's what I'm hoping. I wish the CQC would do their bit and come into the surgeries and see exactly what is happening and how many appointments are being carried out by the GP. But the CQC ain't doing their job either, and that's why surgeries can get away with what they're doing. Everybody needs to wake up and take this on board.
I think part of the trouble is there are limits on how many patients a GP can see per day to be safe, and it's something that's agreed with the BMA and so on. And most GPs are going over those safe.
You're doing a
limits.
morning. You work in a surgery, and she's saying to people doing one surgery a week.
Can I finish? So that if you say you're supposed to see, say, one patient every 15 minutes in order to be safe, some GPs are doing 3 in that same space of time, and that means when it gets into the afternoons, sometimes they've gone over the quota for a day or so on, and they can't. I'm not trying to defend it. They can't necessarily always fit in everybody they should do. And if you have increased problems with some of the GP contracts and more paperwork they have to do as well, and staff training and all the rest of it, and they're taking on each other's patients, it just gets to the point where the afternoon has to be sort of put aside for doing all the paperwork and the software, because they have to go through 12 different screens just to sign off a prescription.
Well, we do hear quite a lot from GPs, and that is one of the complaints, that there's actually so much red tape and so much paperwork involved in being a doctor, bizarrely, and that does take up, they're saying, their evenings, but it may be their afternoons. But what Una's saying here is that she's got GPs that only work 1 day a week. Yeah. So they must be working the other days in private healthcare. I'm presuming they're not, delivery drivers. So there
isn't a glut of private GPs. So it may be they're working in more than one surgery during the course of a week.
Or they're doing
could be lots
online,
of different
when you pay to see a private GP online, which is a service that's growing. I think Una's call is really powerful. She's at the coalface.
Well, it is powerful. I think all her calls have been really powerful, but what I've realised is there's so many different areas that need to be looked at, and it is just a sort of omni-shambles of
one of the things about blame, and whether we blame the government or not, we could also partly sort of take some responsibility and blame ourselves. A third of us are obese. We don't take enough exercise. We should do our bit to protect the NHS as well.
OK, Una, thank you very much for your call. Thanks for all your calls after the break.